I think in order to improve and increase the enrollment and inclusion of diverse groups in clinical trials, that it is important to rebuild and reestablish a level of trustworthiness in the medical community. Often I hear my colleagues say that African Americans don't want to participate in clinical trials, and that simply is not true. When I'm speaking with African Americans who seek out my research that has only demonstrated um, efficacy in mice, and we have not yet begun human clinical trials, they are not being invited by their oncologists to participate. So I think on one hand, it's important for oncologists directly to invite their African American patients and at least inform them about clinical trials. Um, on the other hand, I think it's very important to understand the sensitivities and the scars that are present because of what happened with the Tuskegee experiment, with Henrietta Lacks, and with so many other individual African American families or families from diverse backgrounds, because there's a communication gap between technical medical terms and the average understanding of the average person who may not have gone to medical school or may not have even a college degree, and being able to communicate at a level that is plain English where they can understand what is being said to them. Overall, having a level of transparency about what the clinical trial is and what the potential risks are upfront will help. As a cultural experience, the people in my community and my family who look like me prefer transparency over a long period of time to help build trust. But when there is something that is not shared up front, but then it's shared later, it gives us a feeling of being extremely uncomfortable, and it makes us immediately not trust something. So these are the instincts that have allowed us to survive, but that also could interfere with our willingness to participate in a clinical trial. For example, there's a huge mistrust with the COVID-19 vaccine, and people are perplexed about why more African Americans aren't taking the vaccine, but no one's addressing why African Americans who aren't taking the vaccine don't trust the vaccine. And the reason for that is there is a long track record of untrustworthy activities that have been committed by the medical community overall. And until that's one, addressed, and two, addressed in a way that offers reassurances that this will not happen, that we are taking everything into consideration. And so that's the first thing. But the second thing, but to be completely transparent about what risks are involved and to educate people about what's happening. The other things that matter is having a presence in the community. If we don't know you, we can't trust you. So some of the foundations that your pharmaceutical partners may have, encourage them to invest in community-based organizations and nonprofits in the communities where they would like to recruit people to participate in clinical trials, so that there is not such a big distance between who's going to participate, who's recruiting them to participate in the clinical trial, and what happens. So there are legitimate fears that people have to overcome, and that can only happen when trust is reestablished and familiarity is gained.